Hello friends, this is Alex. In this video, I am going to teach you some of the very important question and answers for NABH assessment. Okay? आज की वीडियो हिंदी और तेलुगु में भी अवेलेबल है. So this video is not only useful for the doctors and nurses, it may be useful for the housekeeping people and security persons also. Because NABH is not only focusing on doctors or nurses or a top level management, it will focus on the ground level staffs also. So without wasting much time, if you follow my channel, okay, I will give you more information regarding the NABH assessment, how to get the pre-accreditation certificate and total main accreditation certificates. So for getting these certificates, you need to face the NABH assessors. Okay, they will ask you a lot of questions. Okay, how to answer those questions, I will just simplify the answers and give you. So moving to the question and answer session, please subscribe my channel. Okay, today's first question is, how many emergency codes do we have in ESIC Hospital Hyderabad? Why I am mentioning ESIC Hospital means currently I am working with the ESIC Hospital, so that's why I'm asking about the related questions to the ESI Hospital. Okay, tell me, how many emergency codes do we have in our hospital? Your answer is 7. Okay, if I assessor ask you how many codes do you have, कितना कोर्स है, कितना इमरजेंसी कोर्स है आपका हॉस्पिटल में, तो आपका आंसर है 7. ओके, and what is the emergency codes activation number? How you will activate the emergency codes? So your answer is dial 2222. Okay, and क्या क्या కోడ్స్ है आपके पास, ఎమర్జెన్సీ కోడ్స్ ఎన్ని ఉన్నాయి, 7. ఎలా యాక్టివేట్ చేస్తావు, బై డయలింగ్ 2222. అండ్ కోడ్స్ ఏంటి, ఏవేవి ఉన్నాయి, what are the codes do you have? Okay, code blue, code red, code pink, code yellow, code orange, code violet and code black. So these are the 7 codes presently we are following in the ESIC Hyderabad hospital. Okay, it may be vary from hospital to hospital. In some other hospital they may follow some other codes. Okay, coding also different for these scenarios. There is no international standard rules for this. Okay, out of all these 7 codes, so mostly there are 4 codes are very important. Code blue, code red, code pink, code yellow, these are the important codes. What is the code blue? Code blue for cardiac arrest or medical emergencies. Okay, code red for fire, in case of fire you will activate the code red. Code pink in case of child abduction or child missing. Okay, code yellow in case of disaster, external disaster. Code orange for spill management, any hazardous spill. Okay, hazardous spill happen, then in case you will activate the code orange in the ESI hospital, not in other hospital. Code violet for violent situations. Code black in case of bomb threat. So these are the emergency codes you have. आपको ESI hospital में क्या क्या codes है, code blue, code red, code pink, code yellow, code orange, code violet, code black. That's all. Okay, how you will activate? By dialing the 2222. Okay, so that is your answer. So Telugu, code blue, code red, code pink, code yellow, code orange, code violet, code black, ఈ codes మనకున్నవి. Okay, ESI hospital లో కోడ్ బ్లూ కార్డియాక్ అరెస్ట్ అయితే, కోడ్ రెడ్ ఫైర్ అయితే, కోడ్ పింక్ చైల్డ్ మిస్ అయితే. ఓకే, ఇన్ కేస్ ఆఫ్ ఎనీ డిజాస్టర్, ఏదైనా అనుకోని సంఘటన భారీ డిజాస్టర్ అయితే అవుట్ సైడ్, సో కోడ్ yellow, spill management, violence, bomb threat. So these are the codes. Next question, how many firefighting facilities we have in our hospital? Okay, assessor may ask you, suppose assessor एक housekeeping staff के पास गया, he can ask housekeeping person like, आपके पास कितना फायर फाइटिंग फैसिलिटीज है, अगर फायर हो गया, आग लग गया आपका हॉस्पिटल में, कैसे मैनेज करोगे, क्या क्या फैसिलिटीज है आपके पास. ओके, हमारे पास है होज रील, होज पाइप, स्प्रिंकलर्स, स्मोक डिटेक्टर्स, पोर्टेबल फायर एक्सटिंग्विशर्स. ओके, ये है, ये 5 टाइप की फायर फाइटिंग फैसिलिटीज वी हैव इन आवर हॉस्पिटल. होज रील, होज पाइप, sprinkler, smoke detectors, portable fire extinguishers. Okay, these are the 5 types of firefighting facilities we have. I clearly showing in this images. Okay, so ఫైర్ ఫైటింగ్ ఫెసిలిటీస్ ఏమున్నాయి మన హాస్పిటల్లో? హోజ్ రీల్ అంటే ఫస్ట్ ఇమేజ్. ఓకే, రీల్ లాగా గోడకు పెట్టి ఉంటుంది. హోజ్ పైప్ అంటే దేర్ ఇస్ ఏ పైప్ లాగా పెద్దగా ఉంటుంది, పెద్ద ఫైర్ అయినప్పుడు ఆపడానికి. స్ప్రింక్లర్స్ అంటే పైన ఫ్లోర్ కి ఫిక్స్ చేసి ఉంటే ఎప్పుడన్నా ఫైర్ అయితే అవి స్ప్రింక్లర్ బ్రేక్ అయ్యి వాటర్ వస్తుంది అనమాట. స్మోక్ డిటెక్టర్స్ ఉన్నవి. ఫైర్ పోర్టబుల్ ఫైర్ ఫైటింగ్ portable fire extinguishers also there. Okay, this is your answer. How many firefighting facilities we have? 5. Okay, what are those? Read about this thing. Okay, next question. What will you do if fire happens? In case of fire, what you will do? ऐसे सर पूछेगा आपसे, आग लगे आपके एरिया में, क्या करोगे? What is your answer? ఫైర్ అయితే ఏం చేస్తారు? యువర్ ఆన్సర్ ఈజ్ రేస్. ఓకే, డోంట్ టెల్ స్టోరీస్, డోంట్ టెల్ RR స్టోరీ or RRR స్టోరీ. యువర్ ఆన్సర్ ఈజ్ రేస్. వాట్ ఈజ్ రేస్? బాగా నై. రేస్ స్టాండ్స్ ఫర్, రేస్ అంటే ఆర్ ఫర్ రెస్క్యూ, ఏ ఫర్ అలార్మ్, సి ఫర్ కంటైనింగ్ ఫైర్, ఈ ఫర్ एक्सटिंग्विश और इवैक्यूएट. ओके, सो व्हाट इज योर आंसर? रेस का मतलब क्या है? रेस मतलब आर मतलब रेस्क्यू. रेस्क्यू मीन्स एनीवन इन इमीडिएट डेंजर, यू नीड टू सेव. ओके, अगर पॉसिबल है तो सेव करने के लिए प्लान करो, रेस्क्यू. ओके, आर and A for alarm. Activate the alarm. How you will activate? By dialing the 222 or nearby manual call points will be there. Break the glass and press the button, then fire alarm will come. Okay, manual call point, or in case of manual call point is there, go to the telephone nearby in your counter, dial 2222, activate the code. How you will activate? You need to know the location of the where the situation happened. Okay, you need to mention that attention please, code red, male medical ward. Attention please, code red, male medical ward. Clearly specify which block also. Okay, that is also important. That is called activation. Rescue, alarm. C, containing fire, contain, close the areas, so to not spread the fire to the other areas. Okay, we are cutting the oxygen there, so that is called containing fire. E stands for extinguish or evacuate. In okay, if possible extinguish, try to stop the fire, otherwise evacuate, clear the area. So that is your answer. ఫైర్ అయితే ఏం చేయాలి? మీరు ఆన్సర్ రేస్ అనాలి. ఆర్ అంటే రెస్క్యూ చేయటం, ఏ అంటే కాపాడటం, ఏ అంటే అలారం యాక్టివేట్ చేయటం, సి అంటే ఆ మంటల్ని ఆ ఏరియాకి పరిమితం చేసి ఉంచడం, కంటైన్. ఈ అంటే ఎక్స్టింగ్విష్, ఆర్పటం లేదా ఖాళీ చేసి వెళ్ళిపోవటం. సో దట్ ఈస్ యువర్ ఆన్సర్. హౌ మెనీ టైప్స్ ఆఫ్ పోర్టబుల్ ఫైర్ ఎక్స్టింగ్విషర్స్ డూ వీ హ్యావ్? మనకి ఎన్ని రకాలైన పోర్టబుల్ ఫైర్ ఎక్స్టింగ్విషర్స్ ఉన్నాయి? పోర్టబుల్ గా తీసుకువెళ్ళి ఆర్పగలిగే మంటలను ఆర్పే సాధనాలు ఎన్ని ఉన్నాయి? సిలిండర్స్. ఓకే, సో వీ హ్యావ్ 4 టైప్స్ మెయిన్లీ: వాటర్ టైప్, ఫోమ్ టైప్, డ్రై కెమికల్ పౌడర్, CO2 టైప్. CO2 అంటే कार्बन डाइऑक्साइड टाइप. क्या क्या है पोर्टेबल फायर एक्सटिंग्विशर टाइप्स? क्या है? వాటర్ టైప్, ఫోమ్, డ్రై కెమికల్ పౌడర్ టైప్, CO2 టైప్. ఇవి దేని మీద, ఏ మంటల మీద ఏం వాడాలి అంత డీప్ గా వెళ్ళరు. అట్లీస్ట్ రిమెంబర్ దిస్ థింగ్స్. ఓకే, మనకి గోడకు పెట్టి ఉంటాయి సిలిండర్స్, आपको दीवार पे होगा ये पोर्टेबल फायर एक्सटिंग्विशर्स. इसमें कलर कोड्स है और टाइप ऑफ फायर में डिफरेंट टाइप ऑफ एक्सटिंग्विशर्स यूज करेंगे. वो क्या क्या है? वाटर, फोम, DCP and CO2 types. So this is your answer. And next, how to use the portable fire extinguisher? ఈ portable fire extinguishers ని ఎలా యూజ్ చేస్తారు? Your answer is pass. Okay, PASS, PASS. पास मतलब क्या है? P stands for, ये पोर्टेबल फायर एक्सटिंग्विशर को यूज करने का तरीका. P stands for pull the pin. First you pull the pin and aim at the base of the fire, not on the top of the fire. Aim at the base of the fire. And S stands for squeeze the handle. Squeeze the handle. Another S, sweep side to side, sweep this side to side. Okay, this is your answer. Portable fire extinguisher ni ela use chestar? Answer pass. P ante pull the pin. A, aim at the base of the fire. S, squeeze the handle. Another S, sweep side to side. Okay, that's all. మీరు పాస్ అయిపోయారు. ఓకే, నెక్స్ట్ క్వశ్చన్, వాట్ ఆర్ ది ఇంటర్నేషనల్ పేషెంట్ సేఫ్టీ గోల్స్? ఓకే, ऐसे सर मेनली एडमिन पीपल को या नहीं तो बेड साइड नर्सेस को और डॉक्टर्स को पूछेगा ये क्वेश्चन. ओके, इंटरनेशनल पेशेंट सेफ्टी गोल्स అంటే ఏంటి? ओके, इंटरनेशनल पेशेंट सेफ्टी गोल्स का मतलब क्या है? ओके, क्या क्या है, कितना है? सो टोटल वी हैव 6 इंटरनेशनल पेशेंट सेफ्टी गोल्स. व्हाट आर दोस? First one, identify the patient correctly. Second, improve effective communication. Third, improve the safety of high alert medications. Fourth, ensure correct site, procedure and correct patient surgery. Fifth one, reduce the risk of healthcare associated infections. Sixth one, reduce the risk of patient harm resulting from falls. Okay, these are the internationally accepted patient safety goals. Every healthcare worker should know these international patient safety goals. 6 are there. Okay, what are those patient safety goals? First, identify the patient correctly. How you will identify? Two patient identifiers, at least full name of the patient, and second one IP number and MRD number. Okay, these are the two patient identifiers. How? By the full name of the patient, and second one by the patient IP number and MRD number. And next one, improve the effective communication. How you will improve the effective communication? Communication को improve करने के लिए क्या करोगे? Proper handing over, taking over, writing the proper documentation, maintaining proper documentation, whether it is a doctor's progress notes, initial assessment, or nurses records, or a care plans, okay, or medication charts, whatever it may be. Handing over, taking over should be proper in a documented way. Okay, that is called improving the effective communication by between the doctor to doctor, between the nurse to doctor, okay, between the lab technician to nurse or a doctor. So this is called a improving effective communication. Communication should be proper. Okay, that is the second one. Improve the safety of high alert medications. High alert medications are there in every hospital. Okay, some of the high alert medications will be there. For then you have to store in a separate places. Okay, in a by labeling the high alert medication, keep in a separate places. Okay, that is a, I will tell you in the next slide. So how to maintain the high alert medication. And next point, ensure correct site, correct procedure, correct patient surgery. Okay, before doing surgery you need to follow the in the pre-op, during surgery. Okay, maintain the WHO standard surgical safety checklist is there. You follow this surgical safety checklist, PAC, all those things. Okay, correct site, correct procedure, correct patient. That is very very important. Okay, and next, reduce the risk of healthcare associated infection. By following the all infection control practices, you can reduce the hospital acquired infections. Okay, reduce the risk of patient harm resulting from falls is very very important. So reduce the reducing falls, we are doing the fall risk assessment by at the time of admission only. Okay, during the hospital stay also provide the um, fall risk uh, fall risk preventive measures also need to be followed by applying the side rails. Okay, applying the restraints. Okay, giving assistance during the walking and all these things are coming under international patient safety goals. Next question, how to improve the safety of high alert medication? Okay, ऐसे सर आपका डॉक्टर से या इंचार्ज से नर्सेस से पूछेगा आपका एरिया में हाई अलर्ट मेडिकेशंस है. व्हाट आर द हाई अलर्ट मेडिकेशन? पिंच मेडिकेशंस आर देयर. ओके, व्हाट आर दोस? potassium chloride, insulin, heparin. Okay, all chemotherapeutic drugs. Okay, chemotherapeutic agents. Okay, or what there may be different high alert medications in your area. So how to improve safety of the high alert medication? It should be stored under lock and key. Okay, all the high alert medication should be stored under lock and key, and narcotics to be stored under double lock and key. Okay, with locks to be keys to be maintained with the 2 persons, in charge and shift senior. Okay, and before dispensing, double checking. Before dispensing, double checking should be there. Okay, and before administration also double checking. Okay, for the higher rate medication. This is the main important and need to be documented carefully. Next, how to store high alert medication, high risk medication. Okay, high risk medications again need to be stored with the labeling of red sticker and lock and key. Dispensing, administration, you need to check, double check. Examples I told you already: insulins, narcotics like fentanyl, morphine, injectable potassium chloride, and intravenous anticoagulants like heparin, sodium hypochlorite, um, above 0.9%. It means 3% NS, all those things, and concentrated electrolytes. So these are coming under high risk drugs. Okay, next, narcotic policy is very important, my dears, for who are working in ICUs and casualties, OT areas, even in wards also. Wherever you are maintaining narcotics, you need to follow the narcotic policy. What is the narcotic policy? Narcotic policy means narcotic drugs like fentanyl, morphine, whatever the drugs you are using in your area, that should be stored in the double lock and key. One key with the in charge, one key with the shift senior, or in case in charge is not available in the night, the another key available with the duty anesthetist. Okay, that's it. And next point, broken and used ampoules are retained and accounted after usage, and loaded injections are to be discarded after 24 hours under doctor's supervision, and expiry date is labeled. Okay, and a separate narcotic register is maintained. Okay, separate narcotic register to be maintained where the usage and administration of such drugs is documented. Whatever the drug you are using, it should be documented. How many you are using, how much, for which patient details also to be right. Okay, after using it should ample should be returned to the in charge. Okay, that is a policy. And next, how you label and store a high risk and LASA drugs. Same, high risk drugs to be labeled by red color, sound alike, green color, look alike, yellow labeling. LASA drugs to be stored separately and has to be followed double check. Okay, and by labeling also, and there is a separate thing to remember. Follow the Tallman letters thing also. Okay, okay, for the LASA drugs. Sound alike, look alike. LASA means look alike and sound alike. And next, what is the protocol on open vials? Open vials का protocol क्या है? Open vials have to be labeled for its date and time of opening, okay, and with initials of the assigned staff, and has to discard within 30 days of opening vials. Vials like 30 ml, 50 ml vials, okay, not about ampoules. Okay, label should be there, opening date should be there, expiry date should be there, who opened, that also should be labeled. Okay, that's it. That is the policy for open vials. And what should be the temperature of refrigerator in which medication is stored? Okay, refrigerator temperature, how much to be maintained? 2 to 8 degrees Celsius. Okay, and fridge temperature checklist or temperature register should be maintained. Okay, that is also one of the question asked by the assessor. समझ में आ रहा है आपको? फ्रिज कहाँ पे भी है, वहाँ पे टेम्परेचर चेकलिस्ट होना चाहिए और टेम्परेचर रजिस्टर होना है, ईच शिफ्ट में चेक करना है, साइन करना है, और फ्रिज का टेम्परेचर 2 to 8 डिग्रीज बिटवीन मेंटेन करना पड़ेगा. ओके, that's all. Next, what is the shelf life of opened IV fluids or opened vials or opened bottles? Okay, they will ask you definitely for nurses and doctors. Okay, opened IV fluids ka 24 hours, within 24 hours you have to discard if you open once IV fluid. For reconstituted vials, 24 hours. Okay, within 24 hours you have to discard. And a life of opened vials, 1 month, 30 days I told you already. And it should be labeled open date, time also. Okay, and hospital policy and pre-filled syringes. Pre-filled syringes like infusions को देते हैं हम लोग syringes में, और IV fluids also will give. Okay, what is the policy, how to maintain those things? Patient name, UHID should be there on the Suppose if you are giving IV fluid to the patient, okay, suppose in a NS 100 ml NS you are giving some antibiotic, suppose antibiotic meropenem you are giving. On the bottle you should write the patient name, UHID, okay, or IP number, and what drug is there. Okay, injection meropenem 1 gram. Okay, dosage, route, and dilution also you need to mention, and date of preparation, starting time, okay, and prepared by, all these to be, and flow rate also need to write. If it is a infusion also same thing, what is the drug, what is the flow rate, okay, what is the concentration, okay, all this to be mentioned and labeled. Labeling should be there, okay, that is the safety. Okay, नेक्स्ट, व्हेन शुड द एम्बुलेंस मेडिकेशन टू बी चेक्ड. एम्बुलेंस वालों को भी पूछेगा, एम्बुलेंस में चेकलिस्ट होना चाहिए, डेली चेकलिस्ट को चेक करना पड़ेगा, ड्रग्स को चेक करना विथ एक्सपायरी डेट्स, ओके, एंड ऑक्सीजन लेवल शुड बी चेक्ड इन द एम्बुलेंस, ओके, all the emergency equipments, defibrillator, all those to be, if it is ACLS ambulance, defibrillator, ECG machine, all these things to be checked, okay, that is a thing for ambulance. And when the patient admitted, who and within what time frame initial assessment should be done. Okay, initial assessment कितना टाइम में होना चाहिए, इनिशियल असेसमेंट ఎంత టైంలో అవ్వాలి, ఎవరు చేయాలి. ఈఆర్ లో డాక్టర్ విత్ ఇన్ 5 minutes అండ్ నర్స్ కూడా విత్ ఇన్ 5 minutes. ఓకే, ఐసీయూస్ లో విత్ ఇన్ 30 minutes అండ్ నర్సెస్ ఆల్సో విత్ ఇన్ 30 minutes. ఈవెన్ ఇన్ వార్డ్స్ ఆల్సో 30 minutes for doctors and nurses. Okay, initial assessment is very very important. आपका नर्सेस का और डॉक्टर्स को भी होगा इनिशियल असेसमेंट. आपका एरिया में रिसीव होने के बाद कितना टाइम में आप इनिशियल असेसमेंट किया. ओके, दैट इज वेरी वेरी इंपॉर्टेंट. ईयर में when you receive a patient, within how much time, within 5 minutes you have to finish your initial assessment. In ICUs also, doctor or nurses within 30 minutes, okay, initial assessment should be completed, and that initial assessment record should be also maintained. And next question, what is triage? Triage is a process of sorting of patients based on priority for treatment to do the best for the most. Triage is very important for the casualty peoples. Okay, triage is nothing but separation of the patients for giving them better treatment. Okay, and who are vulnerable patients? Vulnerable patients कौन है? वार्ड में, कैजुअलिटीज में, आईसीयूज में भी नर्सेस को, डॉक्टर्स को पूछेगा वल्नरेबल पेशेंट कैटेगरी में कौन कौन आएगा, उनको क्या क्या फैसिलिटीज है आपके पास, कैसा ट्रीट करोगे. ओके, दोस थिंग्स. पहले वल्नरेबल पेशेंट्स कौन है? जीरियाट्रिक पेशेंट्स लाइक ओल्ड एज पेशेंट मोर देन 65 years of age, pediatric patient less than 16 years, and physically challenged patients, mentally challenged patient, pregnant women, immunocompromised patients, and patients unable to perform their activities of daily living, ADL. ओके, इनिशियल असेसमेंट में भी आपको पता चलेगा वल्नरेबल पेशेंट वल्नरेबल है और नॉट. ओके, इनिशियल असेसमेंट को आपको एडीएल है, ओके, एज होगा, ओके, वो फॉल रिस्क असेसमेंट करेगा, ओके, वो सब करेगा. सो तभी आपको पता चलेगा ये वल्नरेबल पेशेंट और नॉर्मल पेशेंट. ओके, these are the examples for the vulnerable patients. Okay, what facilities to provide vulnerable patients? आपका हॉस्पिटल में क्या क्या फैसिलिटीज है? Okay, vulnerable patients को hand grabs in washrooms definitely should be there. Okay, hand grabs, okay, and anti-skid tile should be there in hospital. Okay, call bell in the rooms, patients को बुलाने, staff को बुलाने के लिए call bell system, adequate lighting. Okay, ensure constant monitoring at attendance by relatives and staff nurse respectively. In case if it is ward, in ICUs only staffs only, nursing officers only will look after, and helping in activities of daily living. These are the minimum facilities we are providing. And sentinel events क्या हो सकता है? What is sentinel event? List down some of the sentinel events examples. Any unexpected occurrence involving permanent injury or death of a patient or employee or visitor in the hospital is termed as a sentinel event. Any unexpected event is called as a sentinel event, whether it is to a patient or a employee or a visitor, that is called sentinel event. This happens after hospital admission. Patient is admitted for more than 14 days because of the incidents. Okay, this is analyzed intensively within 3 working days. Okay, इसको 3 वर्किंग डेज में एनालाइज करेंगे. So examples for the sentinel events: surgery performed in the wrong body part, okay, and a wrong body part, a wrong person, okay, discharge of an infant to the wrong person, that is a very dangerous situation. Medication error leading to a death or a permanent loss of organs, medication errors, administration error, prescription error, okay, whatever the error related to medication. And a slip or trip or a fall leading to death or permanent loss of organ, fall risk is a sentinel event. Sexual assault within the healthcare facility, okay, PASH should be there, prevention of sexual harassment committee should be there in every organization, okay. If in case any sexual assault happen, okay, in the healthcare organization, that is a sentinel event. Hospital acquired infection like VAP, ventilated associated pneumonia, Gaute, catheter associated urinary tract infection, CLEPSI, central line associated bloodstream infection, or SSI, surgical site infection. Any hospital acquired infection happen, that is also sentinel event. So these are the examples for the sentinel events. In case any these all parameters they will check, okay, every employee should know all these things. And what is a consent, give some examples, okay. Consent क्या होता है? Consent is a willingness of a patient attender to undergo examination or a minor or major surgery or procedure treatment by healthcare providers. Consent is a willingness, okay. क्या क्या है? What are the examples? General consent, sedation consent, anesthesia consent, surgery consent, iris consent, CT surgery, blood product consent, bronchoscopy, medical. There are a lot of consents you will see in the case sheets. Okay, all consent should be taken by the doctors with the willing after clear explanation to the patient or patient attenders. If they are willing only, who have to take the written consent, then only go for the further treatment. That's all. Okay. And who has to obtain the informed consent? Doctor only. Don't take nurses. Okay. And what is the surrogate consent? This is important. They will ask you. Consent is signed by a spouse or a family member of the patient in a situation when the patient is not in a condition to give his or her own signature, or in case the patient is less than 18 years of age. In case a minor. Simple. If a patient is not in a position to give the consent, if a attender or a family member is giving a consent to the particular procedure, that is called surrogate consent. That's. And what are the types of restraints? Restraints क्या है? ICUs में mainly they will ask you. There are two types of restraints are there: physical and chemical. And physical restraints क्या होता है? Vests or ankle restraints and wrist restraints. Okay. Chemical restraints, all type of sedatives. For applying restraints also you need to get the consent. Okay. That consent is valid for only 24 hours. Okay. Every 2 hours you need to apply and remove. Okay. Allow for the circulation if it is a physical restraint. Okay. Restraint intervals should be there. Every 2 hours you need to apply and relieve. Apply and relieve. Okay. And it should be documented also. Every day doctor should write the get the consent for the restraint, and you need to document. That is very important. And what is our restraint policy? Written order for restraint: consent valid for 24 hours, use appropriate restraint, second hourly relieving of restraint to check for skin integrity, discoloration, cyanosis, cerebral pulses. This should be documented by the doctors and the nurses as well. Okay, that's all. And next question: what are the nursing quality indicators? What are the nursing quality indicators in your hospital? Initial time for initial assessment in emergency ICU wards. Okay. And that is a important quality indicator, how much time you are taking for doing initial assessment. Re-intubation ratio: return to ICU within 48 hours, return to emergency within 72 hours. Nurse patient ratio for ICUs and wards, incidence of bed sore, appropriate handover during shift change for doctors, appropriate handovers during shift change for nurses, falls. These are the nursing quality indicators. Okay. And how many infection control quality indicators we are monitoring? VAP, CLEPSI, Gaute, SSI, NSI, needle stick injury. NSI means percentage of employee vaccination, exposure of blood and body fluid exposure. Okay. And percentage of compliance of hand hygiene practices. These are the infection control indicators. Okay. Next question, what are the biomedical waste categories and bin colors used for disposal? ये भी जनरल टॉपिक है, सबको मालूम होना चाहिए. ये नर्सेस को, डॉक्टर्स को और हाउसकीपिंग, सिक्योरिटीज एंड ऑल लैबोरेटरी पीपल, फिजियोथेरेपिस्ट एंड रेडियोलॉजी पीपल, सबको मालूम होना चाहिए बायोमेडिकल वेस्ट क्या है, कैटेगरीज क्या है, क्या क्या बिन्स है, क्या क्या कलर कोडेंस है, किस में क्या डालना है. ఓకే, ఎందులో ఏది వేయాలి, బయోమెడికల్ అంటే ఏంటి, ఏ బిన్స్ ఉన్నాయి, ఓకే అవన్నీ అందరికీ తెలిసి ఉండాలి. ఓకే, డాక్టర్స్ కి నర్సెస్ కి కాదు, ఆల్ ఎంప్లాయీస్ ఇన్ ది హాస్పిటల్ షుడ్ నో, అందరికీ తెలియాలి. బయోమెడికల్ లో ఎల్లో బ్యాగ్స్ ఉన్నాయి, రెడ్ బ్యాగ్స్ ఉన్నాయి, బ్లూ బ్యాగ్, వైట్, ఓకే మెయిన్లీ ఈ 4 ఉంటాయి అండ్ బ్లాక్ కూడా ఉంటుంది ఫర్ జనరల్ వేస్ట్. బ్లాక్ ఆర్ బ్లూ, బ్లాక్ ఆర్ గ్రీన్ పెట్టుకుంటాం. ఎల్లో బ్యాగ్ లో ఏమేమి వేయాలి, येलो बैग में क्या क्या डालना है, बॉडी पार्ट्स, प्लासेंटा, ह्यूमन टिश्यूज, स्पेसिमेंस, कॉटन, बैंडेजेस, लिनेन, ड्रेसिंग्स, सॉलिड प्लास्टर्स, ओके, केमिकल वेस्ट, expired medicines and cytotoxic drugs, soiled waste and microbiology waste. ఇవన్నీ ఎల్లో బ్యాగ్స్, ఎల్లో కలర్ బిన్స్ ఆర్ ఎల్లో కలర్ బ్యాగ్స్ में all human and anatomical body parts, okay, human anatomical body parts are contaminated with the means body fluids, అన్ని కూడా microbiological waste, linens, all should be discarded in the yellow bag. Red bag में क्या है, all type of plastics, disposable syringes and urine bags, catheters, stents, drains, gloves, aprons, any other tubings. Red bag, okay, रेड बैग में क्या क्या डालना है, ऑल प्लास्टिक आइटम्स डालना पड़ेगा. ब्लू बैग्स में क्या क्या डालना है, ब्लू बैग में broken glasses, all type of glass, okay, broken glassware, metallic body implants, slides, vials and ampules and except cytotoxic waste, okay, all type of glass items blue bag में डालना पड़ेगा. white क्या है, puncture proof container, PPC, okay, puncture proof container में all sharps, needles, blades, scalpels, nails, lancets, ओके ये सब व्हाइट में डालना है, पीपीसी कंटेनर में व्हाइट में షార్ప్ ఐటమ్స్ डालना पड़ेगा. ये ఎల్లోలో ఏమేమి వేయాలి, అన్ని బాడీ పార్ట్స్, ప్లాసెంటా, హ్యూమన్ అంటే మనిషి నుంచి వచ్చే ఆల్ వ్యర్థాలన్నీ, ఓకే, లినెన్స్, డ్రెస్సింగ్ చేసిన ఐటమ్స్, ఓకే, మైక్రోబయాలజీ వేస్ట్ అన్ని ఎల్లో బ్యాగ్లో వేయాలి. బ్లడ్, బాడీ ప్రొడక్ట్స్ ఏమైనా ఉన్నా. రెడ్ బ్యాగ్లో అన్ని ప్లాస్టిక్ ఐటమ్స్, ట్యూబ్స్, లైన్స్, అన్ని యాప్రాన్స్, యూరిన్ బ్యాగ్స్, క్యాథెటర్స్ అవన్నీ. బ్లూలో అన్ని గ్లాస్ ఐటమ్స్ వేయాలి, అంటే గ్లాసెస్ అన్ని, స్లైడ్స్ కానీ, నీడిల్స్ కానీ, మెటాలిక్ ఇంప్లాంట్స్ అవన్నీ కానీ, ఓకే ఓకే సారీ వైట్ మే, ఓకే. గ్రీన్ మే जनरल वेस्ट, पेपर्स, कार्डबोर्ड्स and kitchen waste. Okay, next, where will you discard blades, metallic sharps and metallic body plants? ओके, कहाँ कहाँ आप ब्लेड्स और मेटालिक शार्प्स और मेटालिक बॉडी इम्प्लांट्स डालते, इन पंक्चर प्रूफ और लीक प्रूफ, टेम्पर प्रूफ कंटेनर व्हाइट में, ओके, दैट इज आल्सो इंपॉर्टेंट क्वेश्चन. हाउ विल यू हैंडल द इन्फेक्शियस लिनेन and linen stained with blood and body fluids? Okay, separately why I am asking all these things means they will ask you all these things. Infectious linen, housekeeping को पूछेगा, లినెన్ సాయిల్ అయిపోయింది, బాగా బ్లడ్ తో అయింది, బాడీ ఫ్లూయిడ్ ఫీసెస్ తో అయింది, ఓకే, ఏం చేస్తారు, ఎక్కడ వేస్తారు, कहाँ डालोगे, ओके, ब्लैंकेट्स वगैरह कहाँ डालोगे, उसको डालने से पहले क्या ट्रीटमेंट करोगे, सेग्रीगेट, उसको सेपरेट करके सेग्रीगेट इनटू येलो कलर कोडेड कवर and label it and send it for discontamination with 1% sodium hypochlorite. और पहले लॉन्ड्री को भेजने से पहले 1% सोडियम हाइपोक्लोराइड से डिस्कंटामिनेट करके, ओके, उसको लेबल करके सॉइल्ड लिनेन करके उसको क्या, देन send it to the laundry. Okay, that is important. How you will handle and dispose sharps to prevent needle stick injuries? Okay, needle stick injuries prevent करने के लिए क्या क्या strategies है, okay, सबको always dispose of your own sharps. ओके, आपका शार्प्स और नीडल्स आपको हैंडल करना, दूसरों को नहीं देना. ओके, डॉक्टर नर्सेस को देके, नर्स हाउसकीपिंग को देके, ऑर्डरली को देके डिस्पोज करने के लिए नहीं बोलना. ओके, इफ यू गिव एन इंजेक्शन यू गो एंड डिस्कार्ड द थिंग. ओके, इफ यू आर कट द इफ यू यूज द स्कैल्पेल you should discard by yourself. Okay, needle stick injuries are very common in the healthcare sector. Okay, to prevent needle stick injuries, क्या करना है? Always dispose your own shop. Never pass used shop directly from one person to another. Never recap or bend or break disposal needles. और नीडल्स यूज करने के बाद रिकैपिंग बैन है, रिकैपिंग मत करना. ओके, क्या करना है? रिकैप कर, इफ यू वांट टू रिकैप, यूज द स्कूपिंग टेक्निक और वन हैंड टेक्निक. स्कूपिंग, ओके, वन हैंड. ओके, यहाँ पे कैप है. ओके, यू ओनली यूज one, hold the syringe with one hand, okay, like this. Okay, or a scooping technique. Directly after use, place needles and syringes in the rigid container and dispose used sharps at the point of use itself only. Protect fingers from injury by using the forceps instead of fingers for guiding the suturing. Okay, suturing చేసేటప్పుడు don't use directly your needles, fingers. Use the forceps. And what technique will you follow to recap needle? I told you already, scooping or single hand technique. That is your answer. And what is the NSI, sharp injury protocol? In case of needle stick, what you will do? Needle stick అయితే ఏం చేస్తావు? 3 do's 3 do nots ఉంటాయి. Do not panic, do not squeeze the finger and part are exposed to NSI. Do not squeeze, భయపడొద్దు. Do not squeeze చేయొద్దు. ఓకే, ఇలా నొక్కవద్దు. Squeeze नहीं करना. Wash under running water for 10 to 15 minutes. Running water, tap open करके running water में रखना है, ऐसा. Allow for bleeding. Okay, inform to in charge and ICN. Okay, and one more, do not squeeze like this. Okay, do not place the mouth, finger in the mouth as a reflex. Okay, inform to ICN and in charge, and undergo for investigation as per protocol. Follow the uh, post exposure prophylaxis if necessary. Okay, rise the incident. That is a needle stick injury. In case of needle stick injury, what you will do? Spill management, important for the housekeeping people, very important. Spill అయితే ఏం చేస్తారు? अगर spill हो गया तो blood or body fluid or mercury, कोई भी hazardous material क्या करोगे? Okay, హౌస్ కీపింగ్ పీపుల్కి చాలా ఇంపార్టెంట్. ఏదన్నా వాటర్ కానీ, ఓకే, బ్లడ్ కానీ, బాడీ ఫ్లూయిడ్ కానీ, లేదా మెర్కురీ కానీ, హజార్డస్ మెటీరియల్ పడితే ఏం చేస్తారు? స్పిల్ ఏంటో చూడాలి ఫస్ట్. అది మైనరా మేజరా డిసైడ్ చేయాలి. ఓకే, మైనర్ मतलब 30 ml बिलो, मेजर अबव 30 ml అయితే మేజర్ స్పిల్. ఓకే, क्या करोगे? First, they cover the spill area with the chair or any other object to obstruct the page. Okay, मतलब उससे अच्छा बेटर प्लेस द caution board. Okay, caution board रखो उधर. Okay, cover the spill area. Next, cover with the tissue paper वगैरह. Okay, bring the spill kit. Spill kit each area में है आपको. Spill kit लेके आओ. Wear PPE apron, mask, goggles and gloves पहन लो. And cover the spill with the absorbent material like tissue paper, gauze paper डाल दो. Freshly prepared 1% sodium hypochlorite उस पे उसका सराउंडिंग्स में स्प्रे करना है. ओके ओके, नॉट इन द सेंटर, सराउंडिंग्स में स्प्रे दी 1% सोडियम hypochlorite to the surroundings. ఓకే, స్ప్రెడ్ అవ్వకుండా చుట్టూ వేయాలి. ఓకే, allow it for 20 minutes. ఓకే, కాంటాక్ట్ టైం. Remove the solid matter with a glove and hand by evacuating the same. ओके, मतलब ग्लव पहन के उसको निकालना है. ओके, సింపుల్ తెలుగు में बताता हूँ. స్పిల్ అయితే కాషన్ బోర్డ్ తీసుకురండి, అక్కడ పెట్టండి. స్పిల్ కిట్ తీసుకురండి. ఓకే, అందులోంచి పీపీఈ తీయండి, అంతా గ్లౌజ్, మాస్క్, యాప్రాన్ వేసుకోండి. ఓకే, సోడియం హైపోక్లోరైడ్ తీసుకోండి, చుట్టూ స్ప్రే చేయండి. ఓకే, దాని మీద టిష్యూ పేపర్ పెట్టండి, దాన్ని అబ్జార్బ్ అవటానికి ఒక 20 minutes వెయిట్ చేయండి. తర్వాత గ్లవ్ వేసుకుని దాన్ని మొత్తం క్లీన్ చేయండి. తర్వాత మళ్ళీ క్లియర్గా వెట్ మాప్ వేయాలి. ఓకే, దట్ ఈస్ ద థింగ్. ఆఫ్టర్ దట్ ఇన్సిడెంట్ రైజ్ చేయాలి, ఇన్ఫార్మ్ చేయాలి. ఓకే, అండ్ ఇన్ కేస్ మేజర్ స్పిల్ ఏం చేయాలి? ఇమీడియట్ గా యాక్టివేట్ ది కోడ్, ఎమర్జెన్సీ కోడ్ బై డయలింగ్ 2222. ఓకే, వాట్ ఈస్ ఎంఎస్డిఎస్? ఎంఎస్డిఎస్ అంటే ఏంటి అందరిని అడుగుతారు. ఎంఎస్డిఎస్ షీట్స్ అంటే మెటీరియల్ సేఫ్టీ డేటా షీట్స్ ఫర్ అవైలబుల్ అట్ హజ్మాట్ కబోర్డ్స్. హజ్మాట్ కబోర్డ్స్ ఉంటాయి, స్పిల్ కిట్ లాగా హజ్మాట్ కబోర్డ్స్ ఉంటాయి. ఎక్కడైతే పెద్ద ఎక్విప్మెంట్స్ ఆర్ సొల్యూషన్స్ ఇవి ఉంటాయి, వాటిలన్నిటికీ ఎంఎస్డిఎస్ షీట్స్ హ్యాంగ్ చేసి ఉండాలి. మెటీరియల్ సేఫ్టీ డేటా షీట్స్. ఇన్ కేస్ ఆఫ్ ఎనీ మేజర్ స్పిల్, ఎనీ మేజర్ ఇన్సిడెంట్స్ అయితే ఈ షీట్స్ చదివి మనం ఫాలో అవ్వాలి అందులో ఏమన్నా. ఓకే, దట్ ఈస్ ఎగ్జాంపుల్స్ కూడా ఇచ్చాము ఏమేమి సొల్యూషన్స్ కి ఎంఎస్డిఎస్ సీట్స్ ఉంటాయని. నెక్స్ట్ ఇంకా ఇంకా ఏమి గుర్తుండాలి యాజ్ ఏ ఎంప్లాయీగా, మీకు స్కోప్ ఆఫ్ సర్వీసెస్ తెలిసి ఉండాలి. आपको every employee should know the scope of service of that particular hospital. And the scope of services should be displayed at the entrance only. Okay, and non-availability of services also should be known by the employee. आपका एरिया में क्या क्या नॉन अवेलेबल सर्विसेज क्या क्या अवेलेबल नहीं है, ओके वो भी. ऑक्सीजन सिलेंडर्स टू बी स्टोर्ड विद लॉक एंड चेन में कहीं पे भी ऑक्सीजन सिलेंडर रख रहे आप, उधर लॉक करना है, चेन के साथ बांधने और उसको लॉक करना है. ओके, इवन इन मैनफोल्ड में मेन इंपॉर्टेंट इन वार्ड्स आल्सो फायर एक्सटिंग्विशर शुड बी देयर एट द मैनफोल्ड्स में कंपलसरी फायर एक्सटिंग्विशर शुड बी देयर पोर्टेबल एटलीस्ट. पेशेंट ग्रीवियंस और undali, staff grievance also should be there, grievance cell should be there, means complaint boxes, complaint system, okay, okay, all those things should be there. And POSH committee, prevention of sexual harassment should also be there, committee also should be. What is, and one more important question, what is the retention period for an MLC file? MLC ante medical legal cases. Medical legal case admission process should be known by the casualty people and ICUs, wards also. Handing our MLC dead body also very very important. ఓకే, అండ్ ఎమ్మెల్సీ ఫైల్ ఎంతకాలం మనం దగ్గర ఉంచవచ్చు. ఎమ్మెల్సీ మెడికల్ లీగల్ కేస్ ఫైల్ విల్ నాట్ బి డిస్ట్రాయిడ్ టిల్ ద కేస్ ఈస్ ఫైనల్లీ డిస్పోజ్డ్ ఆఫ్. ఓకే, ఎంతకాలం కేసు డిస్పోజ్ అవ్వదు అప్పటి వరకు ఎమ్మెల్సీ ఫైల్ షుడ్ బి దేర్ ఇన్ ది ఎంఆర్డి. ఓకే, షుడ్ నాట్ బి డిస్పోజ్. ఓకే, దట్స్ ఆల్ ఫర్ టుడే. సో ఐ హోప్ దిస్ సెషన్ ఈజ్ వెరీ వెరీ आई होप दिस सेशन इज यूजफुल फॉर यू. ओके, आपको समझ में आया होगा. आपको समझ में आया तो प्लीज ट्राई टू सब्सक्राइब माय चैनल, ओके, and follow my channel for the further updates on the NABH and remaining topics also. If you have any doubts, please try to write in the comment box. Okay, if you want any other content also write in the comment box. Okay, any doubts or suggestions, mention it. Okay, feel free to ask anytime on my channel. Thank you so much. Once again I am asking, please press the bell icon, like, share, subscribe. Thank you so much.